If you are over 60, leg symptoms may be more dangerous than they look.
Let me tell you about Dorothy.
Dorothy thought her leg problems were just part of getting older.
A little swelling, a little cramping, a little numbness.
But as a doctor, I have seen many older adults ignore leg symptoms until walking becomes harder. Balance gets worse, or something serious is already developing. Stay with me, because one of these warning signs is brushed off every single day.
Symptom number one leg swelling more than the other.
Mild swelling in both legs can happen for many reasons.
But one leg becoming more swollen than the other deserves attention.
That can be linked to a circulation problem, a clot, or an injury.
Especially if it is new and something is blocking normal flow.
Do not call that just age and move on.
A body that changes on one side is trying to tell you something. Symptom number 2, calf pain or cramping when you walk.
This is different from a random Charlie horse. This is a repeat pattern.
If pain shows up after walking and improves with rest, circulation may be poor.
Older adults miss this all the time, thinking they are just tired.
People say, I must be out of shape. Sometimes that is true, and sometimes it is not. It is your arteries talking to you. Symptom number 3, redness, warmth, or tenderness in one leg.
This one deserves respect. It is not just a skin rash.
A warm, tender, red leg is not something to casually watch for a week.
Sometimes it may be irritation. Sometimes it may be something more serious.
Either way, it should not be ignored for even a single day.
When symptoms are one-sided and changing quickly, your body is not asking for guesswork. It is asking for immediate attention from a medical professional. Let me say this clearly. Waiting is the dumbest habit you can have. After 60, waiting for symptoms to become unbearable is dangerous. That delay can cost people mobility, independence, and sometimes much more.
Once people start moving less, everything starts to decline rapidly.
Strength drops. Balance drops. Confidence drops. It's a downward spiral.
Symptom number 4, a foot or leg that feels unusually cold, pale, or bluish.
If one foot looks paler or feels colder than the other, that matters.
Effervescent, especially if it is new and the color change is obvious.
Good blood flow matters for keeping your tissues healthy and alive. When something changes in color or temperature, do not be lazy about it.
Not every cold foot is an emergency, but it is a major clue. And a clear new difference between sides should never be ignored by anyone. Symptom number 5, numbness, tingling, or weakness in the leg.
This can happen with nerve problems or even spine issues.
Left. It can also happen with poor circulation. What matters is the change.
If your leg suddenly feels less reliable or less strong, pay attention. People often use the word just too much here. Just numb.
Tingling, just weak. That word just gets people into serious trouble. Symptom number 6, sores, cuts, or skin changes that heal slowly.
This one gets missed for months. People think it's just dry skin.
Especially in people with diabetes or reduced sensation in their feet.
If skin becomes shiny, discolored, or wounds take too long to heal, act.
That is not a small cosmetic issue. It is a sign of trouble.
Your legs are often the first place where circulation problems show themselves.
Look at the skin. Look at the feet. Look at the healing process. Symptom number 7, sudden severe leg pain or a leg that fails.
This is the one I do not want you to rationalize. Not once.
If the pain is sudden and intense, do not sit there hoping.
If the leg becomes weak or hard to use, it needs urgent care.
So what should you do if any of this sounds familiar? First, look for patterns. One leg or both. Walking or resting.
Is it new or long-standing? These details matter to your doctor.
Second, compare sides.
Swelling, color, temperature, strength.
Be thorough.
Third, do not self-diagnose from one symptom alone. It's too complex.
Leg symptoms can come from many places. Guessing is just weak.
And fourth, bring details. When it started and what changed exactly.
Now let me give you the red flag warning. Listen carefully.
Seek urgent care if a leg suddenly swells or becomes very painful.
Especially if leg symptoms come with chest pain or shortness of breath.
Do not drive yourself if you are in real distress. Get help.
When Dorothy finally came in, she had ignored several critical signs.
She was lucky her daughter pushed her. Not everyone has that.
If you are over 60, your legs are your early warning system. Tell me in the comments, which symptom do people ignore the most?
Subscribe to Oakwell for practical health advice that matters for seniors.
Don't let a ignored symptom slow your whole life down tomorrow.